Well, next up is Dr. Sarah Russell. Welcome, Sarah.
Thank you for the invitation.
So perhaps you can just help in a very short précis tell people about your expertise in aged care, if that's okay.
Well, I'm a public health researcher who had two parents in an aged care home. And after my father died, I spent a lot of time with my mother in the aged care home. Now, it was a very good aged care home. However, with my public health lens, I began to see systemic problems in the aged care sector more generally. And I started writing letters to The Age. About Age is the Melbourne local paper, and with the things that I was noticing. And after my mother died, I really wanted her to have an obituary in The Age because, as you may know, most obituaries about men, and they've all split the atom. Well, my mother didn't split the atom, but she was a wonderful mother, and I wanted that recognised as sort of the social glue. And soon after I wrote that obituary, the opinion editor contacted me to say, "You've written a lot of letters over the last 4 or 5 years. Would you like to write an opinion piece?" And I did, and it was called The Aged Care Gravy Train, and it skyrocketed me into aged care advocacy. I started getting a lot of phone calls. I started writing more opinion pieces based on the stories I was hearing in the phone calls. Just fast forward to today, I now have written 75 opinion pieces about, in fact, one's coming out this week in the Herald Sun, which is exciting for me because I don't often get that audience. But I've just continued to persevere, raising the issues, raising the problems, and getting a following. And I had a small Facebook group with 60 people, and I checked this morning, and there's nearly 5,400 members. So we've grown, we've been persistent, and I just keep calling it out, really. And as a result of the lack of action by this current government, I decided 3 weeks ago that I would nominate to be the Voice's endorsed candidate in Flinders, which is the aged care minister's seat. And I was endorsed, and I am now running for a seat in Parliament, because basically I feel I've been shouting from the sidelines, and it's time for people who really care about this issue, like I do, to step up and try to get a seat in Parliament where I can raise these issues more forcefully. And I really do believe in this independent movement as well, that we need independence in Parliament, particularly those who, like Zali Steggall has climate action, Helen Haynes, the Integrity Commission, Andrew Wilkie, gambling. I will bring aged care to the table, and I will speak without fear or favour. I'm not aligned with any party, and I can really bring that issue to the table. So that's my story, and that's why I'm here today as a federal candidate.
Well, thank you, Sarah. So today we're talking about moral injury, and throughout the day we've had everybody offering their sector perspective. Yep. It's no secret to everyone that aged care has been front and centre of the COVID lack of response during both more recent waves. As you know, both my parents were in an aged care facility and were infected, and I spoke up. So just talking to moral injury, I mean, we've got three target audiences, if you like, for moral injury. We've got the aged care facility managers, owners, we've got staff, and we've got family members. And of course, there's probably four, and the residents themselves.
Yes.
So how are you noticing moral injury, which is either bearing witness or doing something or betrayal, playing out with the audiences that you've been engaged with?
Well, it really does play out. And, as we all know, this audience will be very familiar with moral injury and will be very aware that let's just start with what the first category, because they all experience it differently. But there is a common theme, and that theme is either not being able to deliver the care that you would like to deliver, or not receiving the care that you expect to receive. So the moral injury is really based on that, and it's based on people, okay, in my Facebook group, which started out as being a very civilised affair discussing systematic failures in the system, and yes, there was anger, and yes, there was disappointment, but once COVID hit, the level of anger in my group really escalated. It escalated from families, it escalated from staff, and it escalated from residents living in aged care homes. So the systemic problems that I referred to in my introduction have been there for a very long time. They've been there for a very long time. When the pandemic hit, these systemic flaws caused so many problems. Let's take a good aged care home, for example, and there are good aged care homes. I always have to make that point, that there are good aged care homes. They found the lack of preparedness for COVID in the aged care homes 2 years ago left them really struggling, because there hadn't been, and the Royal Commission confirmed this, there hadn't been a federal plan for aged care. And that left many aged care homes, they were considered individual businesses, and they had to basically make their own plans. And it was so hard, because we saw what happened in Sydney when they were the first outbreaks in Dorothy Henderson, and then we had Newmarch House, which was really sad because so much could have been done to protect those residents. And then in Victoria, when we had the second wave, we had aged care homes floundering because they didn't have the infection control processes in place. The government hadn't given them enough personal protective equipment, and staff were getting infected. They were bringing it into the home, and the staff were had to go obviously in isolation. So there was staffing crisis. We had been promised a surge workforce. There was no surge workforce. So the staff who were working in the aged care homes, let's just take Victoria now, during the second wave, they were struggling to provide the care that they knew the residents deserved and how they wanted to deliver that care. And they were going home exhausted. They were going home with moral injury because they weren't able to provide the care that they had been trained to provide, that they knew that they could provide, but there wasn't enough staff on duty for them to do it. So they were running around pretty much doing task-oriented nursing, which is what we don't want in an aged care home. We want person-centred care in an aged care home. That's what they're taught to deliver, but they weren't able to deliver. And then we had families contacting me because they were locked out of the aged care homes. Many, many families who, like me, visited most days, they weren't worried their family member was going to die of COVID. They were worried their loved one was going to die of neglect. And then we heard stories of many stories of residents confined to their rooms, and families were devastated. They wanted to go in and help them have their meals. Who was helping them drink? Because, you deliver a jug of water to a room, but who's going to help them have the glass of water or the cup of tea? Or who's going to help them with their meals? Who's going to take them to the toilet? Who's going to provide social stimulation? So families were getting more and more worried, and that was leading to a lot of anger, which, as we all know, moral distress can lead to anger because they were feeling guilty. I've left my loved one in an aged care home with the expectation that I would be visiting every day, but now I can't even visit my relative in the aged care home. So it was terrible. And the result has been a lot of very traumatised people, both staff and families and residents whose physical and mental health has declined so much because of the response. And the response has been to lock down the aged care home. And these lockdowns were because the government hadn't planned for this properly.
And weren't able to plan going through it either. I mean, it was reactive and sporadic and all over the place. So I just want to take moral distress is a very normal human emotion. We all
Yes.
experience moral distress. When it gets into moral injury, it has profound impacts on somebody's well-being. And you know, the major symptoms are extreme anger, shame, guilt. And I think what you're saying is all of those audiences, like the aged care workers, are so ashamed that they haven't been able to help people the way they know they should be.
They should, and they can if there's enough staff on duty. Absolutely.
That's right. And then the guilt from family members, and you know, family members that have actually lost their loved ones. I don't know how you deal with it. I don't know how you resolve
the grief. The grief is compounded. I mean,
yeah,
you know, my parents died in an aged care home, but they, you know, the grief of having a loved one either catch COVID or die of neglect because of not, you know, all the things that we know about. And for our Prime Minister to call residents pre-palliative when it was such a so hurtful, because many residents, we know the average length of time a resident lives in an aged care home is 30 months. So you're not pre-palliative for 30 months. And that was such a shocking thing for relatives to hear, that their loved one had died, in many cases not of COVID or not with COVID, but of neglect, to be told that they were going to die anyway. Oh, it's left them so angry and so hurt. And yeah, it's terrible in my view.
So I know from my own experience, like when I saw my parents the first time after they were discharged from Westmead Hospital, when we were allowed to briefly see them on compassionate grounds, it was like they'd come out of disaster zone. They were just shell-shocked. They didn't know where they were. They were totally dazed. And that was even more distressing for our family, to see them in that state of not really you know, what happened. And that's the issue, because I know when I joined some of the calls, and even on the Facebook group that you run, moral injury often coexists with mental health issues such as PTSD. And what I have observed, you know, and I'm not a mental health expert who will require proper diagnosis, but really people very reactive with almost a PTSD reaction to everything that was going on.
Look, even before COVID, you know, I was worried about some families, and I have to say I had to remove them from the Facebook group because they were so angry at what had happened to their parent in an aged care home, or their grandparent in an aged care home, that they had a trigger switch and they would blame staff, and all staff were terrible. And it wasn't treating people respectfully, which is what is a fundamental rule of our group. But so that was happening before COVID. But now, since you've joined the group, you've seen the way some people respond, and it's so quick and it's so hostile. I have to take these people out of the group because they're not, and I feel terrible about that, because they need support and care. So we do also private message them to offer them support and care and refer them for some support and care. But that sort of behaviour is just, well, I mean, I'm not a mental health specialist either, but I see it very much like trauma, like
it is trauma. It is trauma.
It is trauma, but it's like
So I would just say to those watching that if you are triggered or have had an experience, we do have a quiet space. So you can pop into one of the rooms that we have, and somebody will be more than happy to talk to you, because we do understand that all of these discussions do bring up, you know, acute trauma for all of us. We've all been through things. And yet again, you know, more Australians with the floods at the moment are going through yet another crisis, yet another wave, and there will be people in aged care going through that as well. So
I have to say though, Kathie, I have bipolar disorder. I've had it since I was 18, and I live a good life with it. But I have sometimes had to disengage because I find the stories heartbreaking. I cried on national television during an interview on the project because I was asked to tell my saddest story, and I had a very sad story. And this was pre-COVID. So sometimes during the last 2 years, I've just had to disengage just for a week. I had a holiday in January, which was interesting because my holiday in January was when all the Omicron was happening, and I didn't get that holiday because I had to respond to the media. I had to offer, I was collecting the data. But some of these stories, even though I feel quite resilient and quite strong, it affects everybody who hears them. And I have invited both Greg Hunt, the Aged Care Minister, and Richard Colbeck, the Minister for Aged Care Services, to listen to the stories that I'm hearing. And they are heartbreaking. And my lack of power to fix things, I've been speaking for 6 years about suggestions about how to provide some solutions to reform the aged care sector. And it is very hard for everybody involved in this sector. And, I just feel that for my sake and for families' sake, for staff's sake, for managers, providers who are trying their best to provide a good aged care home, we really need a meaningful response from the government to really, really reform this sector.
And I guess, some of the things that you've actually said is very true. Taking care of yourself. This is the time for, I call it extreme self-care. And we all know within ourselves when we've just got to back off. You just got to say no to everyone and take some time to just chill and get into your routine of self-care. But the other thing is twofold, is the lack of trauma counselling in this sector that has been absent. I mean, there's been talk of counselling, but every time I put my hand up for other families and said we really need trauma counsellors, and the aged care facilities I know said we asked around, there wasn't any, so it hasn't been considered.
Well, there was an announcement. There was an announcement. First of all, for anyone living in the community, was allowed to have an extended mental health care plan, so you could get access to counselling. Residents weren't considered in that, and I advocated for that if people in the community, older people, are entitled to it, surely older people living in an aged care home should get it too. And yes, the government realised they'd made an oversight and not treated residents in the same way that they treated other older people. So they announced it. They announced $12 million for a mental health care plan. But they make these announcements, but as you said, where is it? Where is this?
Yeah.
And I actually suggested even perhaps the one part of that mental health care plan could be for the families to go back into the aged care homes. That would help as well. So, we need trauma counselling now because we've been neglected for 2 years. Not just, when I say we, I mean anyone in this sector, whether they be a recipient of care, a provider of care, or a family member, or an advocate like you and I. We're all traumatised by this because people have not only died, but people have suffered extremely during this pandemic. And, as I said, we're all traumatised by it.
So I guess really relevant to this sector discussion, Jeanne Yates spoke this morning, and he's a journalist that was the bureau chief in Iraq and lost 2 of his staff. They were killed on assignment, and he spent many years trying to come to terms with that. And it was when he met a chaplain from Austin Health in Victoria that helped him to deal with the moral injury. And I will say that moral injury at the moment, the research is out even in terms of treatment. But in this situation, it was really helpful because she ran a ceremony where he was actually able, he thought he was forgiving them for not being there and all of those things, but it turned out he was forgiving himself. And I really feel the aged care sector, something that all providers can do and families can do, is actually acknowledge what people have been through, because many of those in aged care at the moment are children of the Second World War. They've been through many life experiences, and none of them would have ever thought or conceived that they would spend their last days in a facility locked away where they couldn't see anyone. So I think that acknowledgement in some sort of beautiful ceremony is needed. Do you have any thoughts?
I think that's a beautiful idea. I mean, I suggested maybe people might like to share photographs of their loved ones who had died during the pandemic, whether it be from COVID or not from COVID. It's been a very sad death. I think that's something else people haven't realised. Even if an older person was pre-palliative during COVID and did die, not of COVID, not with COVID, died of, whatever it is, their deaths have been lonely. Like when my father died, for example, all his 5 children were there, our partners were there, grandchildren were there, cousins. We had a lot of people coming into, and the aged care home provided sandwiches. We had stretcher beds so we could sleep overnight with Dad. So, it was a wonderful death in many respects. But now people who are dying of whatever you want to say, of whatever, but of old age, or they're dying alone. And sometimes family members are allowed in, like 1 or 2, and they're in their PPE, and the older person doesn't even recognise them. It's heartbreaking what has happened in aged care.
Yeah,
and it's not just COVID that's caused the heartbreak.
No, that's right. And I think the greatest honour we can pay to somebody we love is to be there to walk them to the edge of the river. And many family members are really struggling by the fact that they wanted to hold their loved one's hands, whatever the circumstances, and they weren't able to do that.
Yeah.
So Sarah,
yeah.
thank you for joining us.
It's been my pleasure.